But myths, misunderstandings, and stigma continue to be barriers to treatment for many, and the consequences of untreated depression can be life-threatening. Understanding the facts about depression, on the other hand, can save lives. Here are 7 things everyone should know about depression and depressive disorders. 1. Depression doesn't always have a good reason. Sometimes people become depressed for what seems like a good reason. Maybe they lost their job or a close friend passed away, but with clinical depression, there doesn't necessarily have to be a reason for how you feel. The chemicals in the brain that are responsible for mood control may be out of balance, causing you to feel bad, even though everything in your life is going well. There are many things that can cause depression. The causes of depression aren't completely understood, but it is believed that the best explanation for it is that it is probably caused a combination of factors, such as an underlying genetic tendency towards the condition and certain environmental factors that can act as triggers. Having a parent and grandparent with depression increases the risk of depression, suggesting that genetics plays a big role. The rates of depression are also higher among those who have a history of substance use. Other factors linked to depression include brain chemistry imbalances, hormones, seasonal changes, stress, and trauma. Brain chemistry imbalances. Depression has been linked to an imbalance in the neurotransmitters that impact mood regulation. This includes dopamine, serotonin, and norepinephrine. The theory is that having too much or too little of these neurotransmitters can cause or contribute to depression. Hormones. Any flux in the production or function of hormones, for example, pregnancy, menstruation, menopause, or thyroid issues, could contribute to depression. Seasonal changes. Major depressive disorder with seasonal patterns. Seasonal affective disorder is triggered by disruptions in the circadian rhythm of the body. A change in seasons can also disrupt sleep, which can contribute to a depressed mood. Stress and trauma. The loss of a loved one, trauma and abuse, chronic stress, and big life changes such as a divorce or losing a job can trigger depression. Researchers blame this on the high levels of the hormone cortisol that are secreted during these stressful, traumatic times. Cortisol affects the neurotransmitter serotonin and can trigger depression. Depression is more than ordinary sadness. Sadness is a part of being human, a natural reaction to painful circumstances. All of us will experience sadness at some point in our lives. Depression, however, is an illness with many more symptoms than an unhappy mood. When sadness turns into depression, there are some telltale signs, including persistent feelings of sadness or an empty mood, feeling irritable and restless, feeling anxious, hopeless or helpless, loss of interest in activities you once enjoyed, decreased sex drive, low energy or feelings of fatigue, trouble with concentration, memory, and decision-making, changes in appetite, weight, and sleep patterns. Physical symptoms such as headaches, digestive issues, body aches, and pain that don't subside with treatment. Unfortunately, you can't just snap yourself out of depression. If you recognize these signs, seek help from a mental health professional. Children are not immune to depression. A myth exists that says childhood is always a joyful, carefree time in our lives. While children don't experience the same problems that adults do, like work-related stress or financial pressures, this doesn't mean that they can't become depressed. Childhood brings its own unique set of stresses, such as bullying and the struggle for peer acceptance. Depression is a real illness. You are not weak or crazy. Depression is a real illness that researchers believe is caused mainly by imbalances in certain chemicals within your brain called neurotransmitters. Some experts are even starting to frame depression as a systemic disease. The following neurotransmitters play an important role in regulating your mood as well as being involved in many other functions throughout your body. Norepinephrine, what makes your heart rate and blood pressure soar during a fight or flight response or stressful time. Serotonin, the feel-good chemical that helps regulate your mood and plays a role in your overall sense of well-being. Dopamine, helps regulate emotion, memory, thinking, motivation, and reward. Researchers are continuing to learn more about what causes these imbalances as well as other neurotransmitters like acetylcholine, GABA, and glutamate 5 also play a role in depression. Depression is treatable. There are several very effective treatment options available for depression, including medications and psychotherapy. In addition, there are new treatments being developed all the time that are proving to be effective in cases where other treatments have failed. While your treatment should be tailored to best suit your symptoms and overall health, a combination of medication, psychotherapy, and lifestyle changes is often used to help alleviate symptoms of depression. Therapy. Depending on your unique situations, you may participate in individual, group, family, or couples psychotherapy. While there are many types of therapeutic approaches, the following have been study-proven to treat depression: 6. Cognitive behavioral therapy, interpersonal therapy, social skills therapy, psychodynamic therapy, supportive counseling, behavioral activation, problem-solving therapy, medications. Especially when used in conjunction with psychotherapy, there are many medications that have been found effective in the treatment of depression. Again, since depression treatment is not a one-size-fits-all approach, it may take some trial and error to find the medication that alleviates your symptoms with the fewest side effects. The classes of medications commonly prescribed to treat depression include selective serotonin reuptake inhibitors (SSRIs), including Prozac, fluoxetine, Paxil, paroxetine, Zoloft, sertraline, Celexa, citalopram, Luvox, fluvoxamine. Serotonin and norepinephrine reuptake inhibitors (SNRIs), including Effexor, venlafaxine, Cymbalta, duloxetine, and Pristactis, venlafaxine. Monoamine oxidase inhibitors (MAOIs), including Marplan, Soccerbox,